Hi, I'm Helen, and I just want to talk to you about some pregnancy massage today. I want to talk to you about the benefits of pregnancy massage. I'm going to show you the pregnancy cushion that we use here, and also show you a short demonstration of a pregnancy massage on a client that we have. The benefits of pregnancy massage are evident all throughout the term of the pregnancy. Depending on what's happening for the pregnant mum, different aches and pains that happen, we can address those. But generally the benefits include increased circulation, increased relaxation, helps with sleep, helps decrease that muscle aches and pains I talked about and some of the tightness that happens, and basically encourages good hormone balance, which is going to help with a lot of other things. So depending on the size of the client, their comfort, how they want to be positioned on the table. So some pregnant women start off face down, lying in their tummy for the first few weeks and are quite comfortable with that. But after that, they do need a bit more support. And we've got a fabulous pregnancy cushion here, which comes in 3 parts. I'll explain to you how this works. So we have these 2 sections here, which we can adjust depending on the size of the client. And we also have a headrest, which also brings that up to the right level. So the cushion here is quite soft through certain parts here, and also soft in the breast area. But it's very supportive through the sort of hips and shoulders area. So it gives support, but also allows for those other larger areas to get some support as well. So like I said, depending on the size of the client, the stage of pregnancy they're at, how they want to be positioned, but this pregnancy cushion can be used for the vast majority of the pregnancy. Some women are happy on this pregnancy cushion sort of right into the later stages of their pregnancy, but mostly we would use this pregnancy cushion first, second trimester, and then for the 3rd trimester we might position the client on their side, which is a bit more comfortable for them. We'll go through some of those things with you with our pregnant client, so we'll be back shortly. So back again. This is Kat. Hi, Kat. Kat's a therapist here with us, and she's also pregnant. Yay! So Kat, how many weeks are you?
29 weeks.
29 weeks, fantastic. And you've got a nice little bump here. So you've been having some massage while you've been pregnant?
Yes.
Yeah, and it's beneficial?
Yeah, it gets rid of the aches and pain, particularly in the lower back,
yep.
But it helps me sleep.
Oh, fantastic, that's
yep.
good. That's what we want here. So we're going to do a little treatment on Kat and show you what we do when we have a pregnant client on the table. So we'll be back. And we're back. We've got Kat on the pregnancy cushion, and you're quite comfortable there, Kat?
Yep.
Yep, good. So Kat's got a bit of an issue with her hips today, so we're going to do some work through her lower back and her glutes. But it's important to note that with pregnant clients, we don't necessarily release every tight muscle. Because relaxin is released into a pregnant woman's body at a much greater rate than normal, it helps the joints become a bit mobile, which is pretty handy, but there are other times when that becomes a bit painful. But we've got muscles, especially in the glutes, that are protecting Kat's lower back and pelvic area, so we won't release all of those, but we'll release some of them to give her some relief and work a little bit through her lower back. So that's what we're going to do today. There. Alright, you okay if I do your bra, Kat?
Mm-hmm.
Alright, so we just use plain sort of sweet almond oil for pregnancy massage. We don't use any essential oils. It's really important that we're mindful that there are quite a few essential oils that are contraindicated in pregnancy, so we just have a very neutral oil, doesn't have a strong aroma. But is quite good for your skin. So we're just going to put a bit of oil on here. We can use sorbeline if that's the preference, but some of the sorbelines have essential oils in them as well, so we tend to steer away from a lot of those. We just use the plain sort of sweet almond oil. So I'm just going to work through Kat's sort of lower back, the top half of her glutes, and see if we can get that feeling a little bit better for her. So Kat, what are some of the other sort of aches and pains that you've sort of had during pregnancy?
You get pains sort of through your back and shoulders.
Back and shoulders, yeah.
I think just because of the added weight at the front, you're trying to hold yourself up.
Yep, yep.
Legs can start to hurt, mine have just started to hurt.
Right.
Pretty much at some point everything will hurt.
Yeah, okay, okay. Yeah, and that's important to remember, that there's a lot of postural changes that happen for a woman during a pregnancy, different stages, the pelvis sort of tilts in different directions. There's the added weight and the body trying to maintain its centre of balance, so there's got to be an adjustment in terms of muscles in that way. So that's why there's often different things that we're addressing when we're dealing with pregnant clients, depending on the stage of the pregnancy that they're at. The strokes are generally the same as a normal massage, so pretty much most things that we do on a typical sort of lower back issue we can do with pregnant clients. There's quite a lot of trigger points that we just don't go to with pregnant clients, so again, having the right therapist, having a therapist that's qualified is really important in terms of your pregnancy massage. Alright, so I'm just going to work through the top of Kat's glutes here. How you doing there, Kat?
Yeah, that's all.
That's all. And you know, Kat's obviously working while she's pregnant, so we need to take into consideration the stress that she's going through standing up most of the day, and having to bend over a bit, so that's going to put a bit extra pressure on her lower back. But you basically, I'll sort of keep working through her lower back and her hips here, and see if we can get that a little bit loosened for her, and then I'll work my way up her back and make sure the rest of that's okay, because I'm sure there's a little bit of tightness up in Kat's shoulders. Yes, there is. So there's lots to be done here. So we might come back later. Okay, so we've done some work through Kat's lower back and through her glutes, especially sort of at the side, that glute minimus stuff, which can get really nasty. But there are some muscles, as I said, in the glutes we don't release because they're actually helping to stabilise the pelvis. So we're going to do some work now, going on up Kat's back and working on that area. There's a spot sort of we often call a hinge spot, just at that sort of mid-thoracic area, where there's often a little bit of, you know, bending in that direction, which doesn't seem like an awful lot, but can put a lot of pressure through this area. So increased breast size and just changing the posture can put a lot of tension around that area. So we're going to do some work in that area now. And you might find that, you know, there's some tension that was there anyway, but the pregnancy can exacerbate that a little bit more. Different sleeping positions and just general postural changes that happen during the pregnancy can contribute to some of that tension and tightness. But if we can release that and make that a little looser, can often decrease the pain. Like I said, there's some areas we don't release because they're helping stabilise all the joints and things. So yes, we'll do some more work up Kat's back and probably call it a day for her now, and then we'll come back when Kat's a little bigger and the bub's a little bigger, and we'll do some more treatment then. Hi, so we're back again. Got Kat on the table, Kat waving, and we're going to do some side lying treating this time. So Kat, how many weeks are you now?
32.
32, so 8 weeks to go, yay! And we're going to do some work through Kat's back, so you can see that we've got her positioned on her side. Her left side, we try not to have a pregnant client on their right side for too long. It's about the vena cava and the blood supply to the baby and the mum. And we've got Kat with a pillow between her knees to give us some support through her hips there. We've got her nicely draped, so she's all covered up. And we're just going to work through her back here, and then we might do some work through her hips, because her hips are giving her a bit of a hard time again today. But so there's a few other things. Is that right, Kat?
Yeah.
Yeah. Okay. All right. So you know, it's not that different to working on a client when they're lying face down on the table. We're still working in the same muscles, but it's really about them being as comfortable as possible, and us working around that. So I'm just going to work through the muscles at the top of the glutes and down through Kat's lower back. You know, being mindful about pressure, but we don't need to be too precious with pregnant clients. Just working with their comfort levels and making sure they're not too uncomfortable. So is that pressure okay, Kat? Yep. Okay, good. All And it's this side lying position is a good way to get to the glutes and the side here, and later on we'll work down further down the hip there, on the top of the leg. But we can work both sides of the back, pretty much all the way up to the shoulders in this position. And just keep checking in with Kat, make sure she's okay. It's quite warm today, so we want to make sure that she doesn't get too hot. We try and keep our pregnant clients a little bit cooler than normal. So we've got the window open and the cooler on, so hopefully that's going to keep Kat a little cooler. So I'm just going to keep doing some work around Kat's back, but just wanted to show you that sort of side lying position, where, as I said, we can sort of access all the way up Kat's back and sort of all the way around her shoulders, and we can sort of do that on most of both sides there. And if we need to, we can get her on her right side for a very short period of time to do the top of that left shoulder, or even do it seated if we need to. So we just work with the pregnant mum and their comfort level, and gives them a really good treatment. But I'll be back in a minute. We'll do some work on Kat's hips. So we've done some work through Kat's lower back, all the way up to her shoulders, and now we're going to do some work through her hip, through her lateral leg here, and we've got her nicely draped so she's protected and exposing the area that we want to work on. So in this area, in this position, we can access the glutes, the back of the glutes, the lower glutes, the quads and the hamstrings, and this whole lateral leg. Some pregnant women will get some neural symptoms like tingling and numbness and pins and needles and that sort of thing in their legs because of the tightness through this area. So this is a good opportunity for us to work on this and relieve some of that muscular tension. So we can do quite a bit of work through this area in this position while Kat's nice and comfortable. We've got a pillow between her knees just to offload that hip a little bit so we don't have the full weight of the leg sort of hanging off her hip. And we can even suggest that a pregnant woman lie in this position in bed with a pillow or something between their knees to give them a little bit of relief on the hips. So we'll just continue doing a bit more work through Kat's hips here, and hopefully make her feel a little bit better. So I hope that's given you a good indication on what we can do in terms of pregnancy massage, both in terms of positioning and the techniques and things we use. Like I mentioned before, important for you to get a therapist who's qualified when you have your pregnancy massage. Just to sort of be assured that they really know what they're doing. So, all right, thanks for watching. Say bye, Kat.
Bye.